Welcome to the regular meeting of the Public Health and Safety Committee for July 16th, 2025. I am Jason Chavez, and I am the chair of this committee. Before we begin the meeting, I want to offer a friendly reminder to all members, staff, and the public that these meetings are broadcast live to enable greater public participation. These broadcasts include real-time captioning as a further method to increase the accessibility of our proceedings to the community. Therefore, all speakers need to be mindful of the rate of their speech so that our captioners can fully capture and transcribe all comments for the broadcast. We ask all speakers to moderate the speed and clarity of their comments. At this time, I'll ask the clerk to call the roll to verify the presence of a quorum.
Councilmember Payne.
Present.
Rainville is absent. Ellison is absent. Palmisano.
Present.
Vice Chair Wansley.
Present.
Chair Chavez.
Present.
We have 4 present.
Thank you. I'd like to note that Councilmember Rainville will be joining us shortly, and let the record reflect that we have a quorum. Before we begin, I'd like to welcome Michael as the new clerk for the Public Health and Safety Committee. There are 8 items on today's consent agenda. Item number 1 is authorizing a grant from the Minnesota Division of Homeland Security and Emergency Management for emergencies and disasters and accepting said grant. Item number 2 is authorizing a joint powers agreement with the City of Brooklyn Park to conduct wage investigations. Item number 3 is authorizing a joint powers agreement with the State of Minnesota to provide bomb squad services to other municipalities in the state. Item number 4 and 5 are joint power agreements with the cities of Maple Grove and Minnetonka to provide legal services. Item number 6 is approving various appointments to the Public Health Advisory Committee. Thank you to all the residents who applied and stepped up to serve. Item number 7 is authorizing a funding agreement with the City of Lakes Community Land Trust for a real estate purchase. This is facilitating urban farming on the purchased lots. The lots and growers will be identified via a 2025 Urban Farm Community Ownership RFP. Item number 8 is setting a public hearing on the Earn Sick and Safe Time update. This hearing will be on July 30th at 1:30 p.m. Residents are invited to attend and testify. We'll be meeting in this room 3 located at 250 South 4th Street. Information about requesting translators or accommodations can be found at the bottom of the posted agenda. Item number 9 is referring to staff ordinances related to civil rights, specifically adding protections for discrimination based on perceived citizenship or immigration status. And item number 10 is referring to staff an ordinance related to employee authority in immigration matters, adding reporting requirements and clarifying protections. Colleagues, are there any discussions on any of these items? All right. I'll move approval of items 1 through 7, set the public hearing for item number 8, and refer to staff item number 9 and 10. All those in favor say aye. Aye. Those opposed say nay. Those items carry and the consent agenda is approved. Our next item is a receive and file related to municipal grocery stores. This is in response to a staff direction by Vice Chair Wansley at a November 2024 meeting. I'll now invite our legislative and policy research team to get us started. Welcome.
Thank you. Good afternoon, Chair Chavez and members of the committee. My name is Ashley Juk with the Legislative Policy and Research, and I'm here today to present on food access in municipal grocery stores. The committee asked for a report covering food access, food insecurity, cooperative grocery stores, and nonprofit grocery stores in Minneapolis, and a national landscape analysis of municipal grocery stores and other select businesses. This request included many components, and the length of the report reflects that complexity. A note on language: to ensure that references to materials or interviews are properly reflected, we showed deference to the terminology being used by that specific entity. For example, food desert or low income and low access. However, to be consistent with city language, the original language used in the report and this presentation uses the term food apartheid rather than food desert. As the Minneapolis Food Action Plan explains, food apartheid describes community areas with little to no access to grocery stores. Food desert implies that a lack of grocery stores is a naturally occurring concept. Food apartheid calls attention to the policies, systemic racism, and other oppressive powers that have created and prevent certain areas from having accessible and affordable grocery stores. Getting into Minneapolis food access. Food access is generally thought of as a distance to a store and access to transportation. The map on the left, highlighted in green, shows the low income and low access defined as a grocery store within a mile census tracts in Minneapolis in 2019. The map on the right highlights in yellow the low income and low access defined as a grocery store within half a mile, combined with a lack of vehicle access census tracts. But proximity to food is not the only issue affecting food apartheid. Transportation, housing, and other issues also play a role. Though access to fresh food and affordable groceries is challenging for many, it is further exacerbated by racial and ethnic disparities, with counties in the United States with above average Black populations tending to have fewer fresh food options, but more convenience stores. And in Detroit, another study found that residents within low-income neighborhoods with a higher proportion of African Americans had to travel on average 1.1 miles further to access the closest supermarket than residents in predominantly white low-income neighborhoods. According to the food group, it is not an accident that urban Black and Hispanic neighborhoods have fewer grocery options and an abundance of fast food. With grocery store redlining, supermarkets prioritize profit, operating in wealthier suburban neighborhoods at the expense of lower-income city spaces. The Twin Cities Mobile Market helps close some of that gap by bringing affordable and nutritious foods directly to Twin Cities neighborhoods, including 9 sites in Minneapolis that do not have access to full-service supermarkets or grocery stores. Some argue that the root cause of food apartheid is the lack of enforcement of the federal Robinson-Patman Act. The act was meant to ensure suppliers are giving the same price to all of their buyers, regardless of the size of buyers. While it was enforced vigorously until the 1980s, it was then thrown out with most antitrust enforcement in Ronald Reagan's deregulatory push. At the state level, Maine, Minnesota, and Rhode Island are considering legislation that would not just mirror Robinson-Patman, but go further to prevent big grocery chains from dominating the market. Minnesota's Consumer Grocery Pricing Fairness Act, currently in the state legislature, would require suppliers to provide the same terms of sale for grocery items to all retailers and wholesalers. This could increase the viability of smaller grocers of all kinds. Though not intended to be comprehensive, I felt it was important to highlight some of the great work the health department is doing. Homegrown Minneapolis works on food security issues. They're currently using Climate Legacy Initiative funds to work at the intersection of improving food access and reducing greenhouse gas emissions. Previous work includes distributing $2.4 million in COVID-era federal funding to food security partners, including food shelves, hot meal programs, and other types of food distributions, providing culturally relevant, nutritious food to 184,694 households across the city. The Homegrown Minneapolis Food Council helps enact the Minneapolis Food Vision and the Minneapolis Food Action Plan, both of which include goals around equitable food access. And the Healthy Living Initiative includes a focus on improving community nutrition with the goal of increasing nutritious and culturally appropriate foods that are affordable and accessible to all. Details on these programs and some additional highlighted work can be found in the report. Related to food access is food insecurity. Food insecurity occurs when a household cannot access enough food due to a lack of money or other essential resources. Multiple factors can lead to food insecurity, including household income, access to affordable health care, the surrounding social and physical environment, the availability of food in the community, the cost of the food, and how easy it is to get to by available transportation. While accessibility does matter, the main driver of food insecurity in the United States is a lack of money. The U.S. Department of Agriculture estimated in 2023 that the U.S. food insecurity rate was 13.5%. Feeding America estimated Minnesota's 2023 food insecurity rate at 10.4%, one of the lowest in the country. However, Second Harvest Heartland, partnering with Wilder Research, in 2024 found 20% of Minnesota households faced food insecurity, which increased to 26% for households with children, and households of color faced a 40% rate. The map on the left here represents the 2023 projected proportion of individuals in each census tract that meet the U.S. Department of Agriculture's definition for food insecurity. The map on the right represents food insecurity rates per zip code in 2020. As you can see, the darker red portions on both tell a similar story. Hennepin County's estimated 2023 food insecurity rate was 10.3%. The majority of those individuals live in Minneapolis and are concentrated in urban areas, including North and Central Minneapolis, the Phillips neighborhood, and Cedar Riverside. In the 9-county region, Hennepin was found to have the highest disparity in food insecurity across zip codes, with food insecurity ranging from 0% to 29%. As of 2023, the 5-mile radius around zip code 55454 has the highest food insecurity in the 9-county region. I think I practiced too much. I feel like I'm losing my voice. According to the U.S. Government Accountability Office, in 2020 in the United States, about 23% of college students experienced food insecurity, with the majority experiencing very low food security, meaning they reported multiple instances of eating less than they should or skipping meals because they could not afford enough food. Data from spring 2024 shows 21.8% of UMN Twin Cities students reported worrying about whether their food would run out before they had money to buy more, and 12.4% reported experiencing a food shortage and lacking money to buy more within the past 12 months. To address this food insecurity, many colleges and universities do have some type of food assistance available to students, including on-campus food pantries and providing help to enroll in the Supplemental Nutrition Assistance Program benefits. In Minneapolis, numerous campuses have assistance, including Augsburg University Foods Assistance, Minneapolis College Food Pantry, U of M Food Pantry, and University of St. Thomas Food Assistance. I did add, though their campus is located in Red Lake, Minnesota, Red Lake Nation College does have a site in Minneapolis, so I wanted to mention their food pantry as well, which often includes local indigenous food items such as Red Lake walleye and wild rice. Moving into some example cities' grocery store models. To start, I want to make a note that no major U.S. city has opened a publicly owned and operated grocery store. However, across the country, smaller municipalities have with varying degrees of success. The grocery industry is known to be incredibly slim profit margins, averaging 1% to 3%, and this has resulted in many small grocery stores closing within a few years of opening. Some cities frame access to food as a public common good, like access to water and other utilities. Others maintain that grocery stores are best left to the private sector. Whatever route or store model municipalities use to address food apartheid in their communities, experts throughout the report stress the importance of community involvement from the beginning planning stages, as a store will not succeed without initial community buy-in and continued community support. One final note, it is important that a common theme among the subjects interviewed for this report is that when opening a grocery store, a municipality should consider the possibility that the store may operate in loss in perpetuity and could be considered lucky to break even after a few years. This means the store may continue to require additional resources on an annual basis. That being said, Tulsa, Oklahoma is a really great example of a public-private nonprofit partnership. Oasis Fresh Market opened 4 years ago with partial public funding and is currently run by a private operator and owned by a nonprofit. The community-driven project was led by local nonprofit Tulsa Economic Development Corporation and Black entrepreneur Aaron Johnson. The nonprofit was able to attract a broad group of community leaders and funders to finance the project. And as you can see on the slide, the total project budget was $452,000. Oasis Fresh Market is more than a grocery store. They work with many nonprofits to provide education on a weekly basis, including resume building, financial literacy, summer feeding programs, and medical clinics. As the operator stated, their community is not just a food desert. It is a broadband desert, it is an educational desert, it is a hope desert. Grocery stores are only part of the issue in an underserved community. There's a lot of great information about how this project was created, how it's continued to be successful, and lessons learned in the report. If you only read one example city in the report, I strongly encourage you to read this one. It's also important to note that Tulsa's dollar store ordinance may have helped create a situation where Oasis Fresh Market could succeed. It was passed in 2018 and restricts the building of small box discount stores in the city's underserved communities. While the city of Madison does not operate any grocery stores, they are the landlord to two smaller grocers and have been involved with opening a larger grocery store in the historically disinvested South Madison since 2017. It has been a complicated process, and as of now, there's no operating grocery store at the location. The project was instigated with the anticipation that the only full grocer in the area was going to close. To date, that store is still open. The city issued a request for proposals to developers in 2018 and 2019 for an already owned site for affordable housing that would include a grocery store condo. They signed a development agreement in May of 2021. Unfortunately, the initial grocer involved in the project had to back out, which resulted in the city needing to purchase the condo so that the developer could close. There were many further challenges throughout the project, which are detailed in the report, along with advice from Madison City staff to other cities considering similar projects. As of now, the city has spent a total of $10,633,000, including the $4.6 million for the grocery store condo. While the current grocer is still trying to secure financing, at least as when I spoke to the staff, they did let me know in a follow-up email last week that they are anticipating significant progress on this project in the next few weeks. The City of Chicago also recently considered opening a city-owned grocery store. Despite a feasibility study in summer 2024 concluding that a city-owned supermarket was necessary, feasible, and implementable, the city has since pivoted in its plans and instead intends to pursue the possibility of opening a public market, which would be similar to like an indoor permanent farmers market. Proponents of the public market say it could support local entrepreneurs and food producers, and it could also help address the lack of supermarkets in the city's south and west sides. However, successful public markets are typically located in high-density downtown areas because they need lots of foot traffic to remain sustainable. That brings into question whether or not a public market will actually address the issue of food deserts or the interests of low-income people. Last year, Atlanta approved just under $8.2 million in funding for a project that will create 2 grocery stores in low food access neighborhoods. Funds will be used to help build out both locations, supply inventory, purchase equipment, and help with other operating costs. After trying for years to incentivize national grocery chains to open stores in these parts of the city without success, the city chose Savvy Provisions, an independent chain of neighborhood markets, to operate the store for them. The report also reviews several smaller cities and town grocery store models, including one fully city-owned and operated store in St. Paul, Kansas. The St. Paul Supermarket opened in 2008 with 3 funding partners. Public dollars from the residents of St. Paul bought the property and built the physical store. A volunteer group of St. Paul citizens actually invested their own money to buy the business, and a husband and wife team bought the inventory and managed the store. 5 years later, in 2013, the City Commission assumed operation of the store and bought out the other two partners, so it is now a fully municipally owned business. Other smaller cities have chosen other models listed on the screen there, and you can explore those more in the report. On to cooperative and nonprofit grocery stores in Minneapolis. Most food co-ops are consumer cooperatives, meaning they are owned and governed by the people who shop at them. The Twin Cities has actually led the country in the number and innovation of food cooperatives. The backdrop of the co-op wars in Minneapolis in the 1970s surrounded tensions centered on food, race, gender, and class, and the issue of how to include marginalized communities and the question of who a co-op will serve is still fundamental. Flare-ups among competing co-op groups led to occasional violent outbursts, with one takeover attempt in 1976 resulting in 4 arrests, the firebombing of a truck, an attempted firebombing of a store, plus a number of lawsuits and countersuits. And a couple involved council members. It's an interesting history. There are currently 5 cooperative grocery stores operating in Minneapolis. They're listed on the slide there, along with which ward they are located in, as well as when they were opened. Challenges facing these local co-ops, as well as forms of support which could help them address those challenges, are discussed in the report. Also on the slide, you can see the listed Worth Co-op, which opened in 2017 and closed less than a year later. I've noted that the city loaned Worth Cooperative $75,000 using federal community development block grant dollars, and after the co-op's closure, the city wrote off that loan as uncollectible in 2020. I also want to note CPED's dedicated city support of cooperatives. Dedicated funding through their Business Technical Assistance Program supports cooperatives through contracts with community organizations which specifically support the operations of co-ops. They also offer a co-op feasibility class and one-on-one advisory services through Cooperative Technical Assistance Program providers. There are currently 2 nonprofit grocery stores operating in Minneapolis, North Market and Good Grocer. Nonprofit grocery stores are very uncommon, and even fewer have been able to sustain themselves, not just here, but around the country. In their initial capital campaign, North Market received state funding and has since received some programmatic funds through the city of Minneapolis. They currently operate on around 30% philanthropic support. To date, Good Grocer has not received any known public funds. More insights into their successes and challenges can also be found in the report. While directed to review municipally owned and operated liquor stores, cannabis dispensaries, and pharmacies, it should be noted that these all differ greatly from municipal grocery stores, as well as each other for many reasons. Starting with liquor stores are predominantly operated to generate income for municipalities. They also have drastically less competition than other retail businesses because Minnesota is actually the only state in which city government is allowed to have monopoly over retail liquor stores within their boundaries. Minnesota's 1933 Act allowed cities with populations of 10,000 or fewer to establish a store selling alcohol by the bottle or consumption on the premises. Cities with larger populations can also establish a municipal liquor store, but they do have to go through the state legislature. 176 Minnesota communities currently operate 210 municipally owned liquor stores, or munis as they are called sometimes. There's much more information in the report regarding the financial status of all of those located in Minnesota. As for municipally owned and operated cannabis dispensaries, I could not find any currently operating examples. The only historic example I could find was North Bonneville, Washington, which closed down due to lack of profitability. Though some cities in Minnesota have considered opening municipally run stores, none have yet opened. And again, operating a dispensary is very different than a grocery or liquor store. Dispensaries face very unique challenges. These include the reality that cannabis remains illegal at the federal level. There are public health concerns, as well as many banking and insurance issues. The report walks through these in more detail. Similar to grocery stores, access to pharmacies can be a challenge for many Minnesotans. The map here shows pharmacy access gaps in the metro area in 2024. The green low-access areas are census tracts where the population center is more than 1 mile from the nearest pharmacy. Limited pharmacy access tracts in yellow are currently only being served by a single pharmacy, so if that pharmacy were to close, they would lose access. While pharmacy access gaps exist in Minnesota and in communities across the country, I could find no examples of municipally operated pharmacies. The National Council for Prescription Drug Programs reviewed their database for the report and shared that they only had 4 government pharmacy categories. Those were Department of Defense, Veterans Administration, Indian Health Services, and government-owned hospital pharmacies. A 2022 study identified more than 61,000 pharmacies across the U.S., and only 240, or 0.4%, were government pharmacies in those categories. Okay, key takeaways. While this report included many components, all of which offered insight into the topic at hand, I wanted to focus attention on these last few takeaways so that they did not get lost in all of the information I shared today. Number 1, the grocery industry is incredibly challenging, with profit margins typically around 1% to 3%. Specific expertise in the grocery industry is essential for sustainable success. Number 2, any store or other option to address food apartheid needs to be community-driven. Solutions will not succeed without community buy-in and support. And finally, number 3, Minnesota's Consumer Grocery Pricing Fairness Act may increase the viability of independent grocers if it is passed. This is sort of the Minnesota stand-in for the lack of enforcement at the federal level of that Robinson-Papin Act. Thank you so much for your time. That is all I have today, but I'm happy to answer any questions about the presentation or the report.
Thank you so much for the work behind this and for the presentation. I'll first call on Vice Chair Wansley.
Thank you, Chair Chavez.
Sorry, Vice Chair Wansley, if you don't mind. I did want to reflect that Councilmember Brainville is also present. Thank you.
Awesome. Just had a couple of comments and probably loop back after Council President Payne with some questions. But first, just want to say thank you to our staff for completing what was a very thorough report. Thank you for also putting it on all of our desks so that we can have.
I couldn't find your mailboxes. I'm sorry. I shouldn't interrupt.
No, I love coming back from my leave and having this 90-page report on grocery stores on my desk. I enjoyed it actually. Since bringing this directive forward last November, I know I've received feedback and responses out in the community that, municipal grocery stores was this pie in the sky idea. But here we are a year later since passing the directive, and it's been fascinating to watch this issue now, or this proposal become a national discussion point. And we're hearing community leaders even raise the issue across the river in St. Paul, and municipal grocery stores are also being a key topic of ongoing discussion for the New York mayoral's race. It also dovetails with conversations just many cities, as you outlined in this report, across the country are having around how to create more resilient and self-reliant systems to meet their residents' needs, especially in light of this increasingly hostile and volatile Trump administration that's cutting funding for many of the public health and services programs that many communities rely on. So I know in response to those developments, there's been a sentiment from also working class people across the country who are looking to their local governments to step up and find ways to make sure that everyone can afford their basic needs like groceries. And all that said, there's no better time, I think, to be having this conversation. And once again, grateful that we had a team on the legislative side that could take several months to really dive into this with intention and great detail. One thing that did stand out to me about this report was the variety of models that different cities have used to create either municipal grocery stores or these public-private mixed models. And there are examples of a variety of financial tools and administrative models that were used to either fund or sustain these grocery projects. One key theme that I often seen, as you highlighted in your presentation, it took significant upfront cost or investment to attract even private grocers or partners, and a lot of that upfront capital investment came from the cities taking the initiative. So I think that goes without saying that if we are addressing food insecurities in our communities, government do have a crucial role to play in initiating and getting movement around the development of any type of grocery option. And I feel very optimistic that leaders here at the city can get creative with the tools that we have here to also address this issue. But also, thank you for highlighting, which I think it's also lost in our conversations around food desert, and highlighting the fact that food insecurity is extremely a major issue for college campuses and students. I know as the ward that has 2 college campuses with the University of Minnesota and Augsburg University, I often hear this from my students who also, as you highlighted in your comments in the report, some are skipping out on meals or have to subsidize their food costs through taking out additional loans or working multiple jobs, all things that take away from their ability to really hone in and focus on completing their college degree. And this report also states that nearly a quarter of University of Minnesota students are experiencing that very reality, and I think that's just completely unacceptable in our current city, where that shouldn't have to be a reality that is confronting a number of our student residents. Also, one of my favorite quotes from this report was, I think it was from the mayor of the Kansas City, where he does say access to water and clean air are essentially public goods, and putting that line in a stand of like, this is not, unless you're California, like it should not be publicly traded, access to food. And I think, when residents lack access to basic necessities like food, our city has a moral and civic obligation to act. And that really sums up my intention why I'm excited to have the city explore this further. Especially when we know the private market is not meeting the needs for all of our residents across the city. So with that, I do look forward again to working with my colleagues and marinating on a lot of the examples, a lot of the material and content that you put into this report and presentation, really giving a thorough overview of the type of financial tools that might be available to cities like the city of Minneapolis, how we can approach even our city staff, who you also incorporated their thoughts and feedback into this report, on how we can further bring solutions to this issue around food insecurity in our city. So thank you for that.
Thank you.
Thank you. Next up, we have Council President Payne.
Thank you, Chair Chavez. Yeah, I'll echo Vice Chair Wansley's appreciation for the thoroughness of this report. And I know that we didn't explicitly ask for this information, but I'm sure you came across just the kind of broader market conditions that these grocers are operating in. You spoke to how low the margin is, but I think that also is in alignment with the fact that you have Walmart as like a pretty dominant market share. And the grocery industry, we know how Walmart generally operates its business. It undercuts local businesses until they go out of business, and then it can jack the prices up. But I'm wondering if, through your more direct research on municipal grocery, you saw any insights around some of those larger market forces that should be things that we're considering.
So the 1% to 3% average profit margins does include those really large retailers, often because their volume is so massive that they can afford to make 1 penny out of every dollar that they sell. Also, I had mentioned in the oh my gosh, now I'm blanking, Tulsa, the dollar store ordinance. I think I included a couple other examples throughout the report. Again, about that, their market share is so large and their volume is so much that they can come into a community. They sell shelf-stable items, no fresh food of any kind in general. I shouldn't say never, but in general. And then they put out of business local stores, and then people are left with only those few shelf-stable items that aren't necessarily super nutritious or culturally appropriate. So there are some issues at play as well. Then also, like I pointed out, the federal Robinson-Patman Act, that lack of enforcement of the antitrust is definitely impactful. It's had a great, not great as in positive, but a large impact on the grocery store scene, since that has not really been enforced that much. As I stated, also Minnesota has its own version that is currently in both the House and the Senate, and I'm not sure what its probability is, but that's certainly worth talking more to IGR or seeing where that is at as well. Those are the largest market forces that I kind of uncovered. I didn't go in too much in depth in all of the market forces around this business, but those are the biggest highlights.
Thank you.
All right. Well, thank you for the presentation, and I personally look forward to hearing about the next steps. Thanks.
Thank you.
Seeing no further questions, I'll direct the clerk to receive and file that update. And Councilmember Rainville, would you like to be noted on the agenda for the other votes?
Yes, please. I'd vote in the affirmative.
Without objection, Councilmember Rainbow votes in the affirmative on the consent agenda. Our next item is the postponement of a safe and thriving community support plan for public safety beyond policing. I'll pass it to Vice Chair Wansley to make a motion to postpone this item to the September 17th, 2025 meeting.
Yeah, thank you, Chair Chavez. And just a little bit brief context to this. So this item was brought forward by my office last year with the goal of solidifying adoption of the Safe and Thriving Communities Report and Plan, which gives the city a 10-year action plan on how we can build out a public safety system that expands beyond traditional policing. And this has been touted as the blueprint for how the city would be creating a new safety ecosystem that would guide our public safety services and program creation for the foreseeable future, at least, again, next 10 years. In the past, the city would formally adopt plans addressing key issues in our city through the legislative process. This is exactly what was done with the Climate Equity Action Plan. And however, last December, we received feedback from our city attorney's office that gave the opinion that the administration should not do a formal legislative adoption process for the Safe and Thriving Communities Action Plan, and also said that future action plans should no longer also go through the legislative process, which is a completely different precedent. So we took the past couple of months to have further conversations with our city attorney's office and staff to get more clarity on the future of action plans, as well as figure out council's options as it relates to strategic planning and how we can demonstrate formal support for the Safe and Thriving Communities report and plan. So that said, we landed on a presentation from the city attorney's office to come forward on September 17th. That would happen here in the Public Health and Safety Committee. I also anticipate that we'll be accompanying another item with that presentation to address the original intent, which is, again, showing formal support for the Safe and Thriving Communities report and plan. And with that, I also will note we're going to work with Chair Chavez in his other chair capacity to get a presentation from staff as it pertains to the future and status of action plans and strategic planning to be presented to the committee of the whole, because this is information that should be shared with a 13-member body as opposed to just here in PHS. So with that, we'll keep you all posted on when we get that scheduled for Cal, but this will be postponed to September 17th. And I will ask for a second for that motion.
Second.
Seeing no one on queue and no discussion on the motion to postpone this item to the September 17th, 2025 Public and Safety September 17, 2025, Public Health and Safety Committee. All those in favor say aye.
Aye.
Those opposed say nay. Any abstention? And that carries. All right, colleagues. Seeing no further business. Yeah? Okay, Vice Chair Wansley.
Thank you. I thought we did. Yeah, thank you, Chair Chavez. I did just want to briefly comment on a matter that I know a number of council members have been contacted about that's relevant to the business of this committee regarding how we will be responding to the news around Sergeant Mark Henneman being the lead trainer for our use of force training for MPD, and regarding to the MDHR settlement agreement, which mandates this. And just for folks who aren't aware, Sergeant Henneman shot and killed Amir Locke in 2023, who was a 22-year-old black man who was sleeping and was killed within 9 seconds after MPD had entered his apartment where he was sleeping. And this happened through the execution of a no-knock warrant, which many of the public had believed was banned, as Mayor Frye had shared that in a previous year that action had been taken. Of course, there has been concerns around what is the leadership promotion process for officers who engage in these type of actions that lead to the loss of life from residents. I think there's more sensitivity around this was another black resident who lost their life, and there was no traditional justice delivered in that matter. And I at least wanted to reiterate in response to that outreach from the public is, once again, MPD falls within the sole authority of the mayor's office. And I think, of course, it shows to some level of just being tone deaf, but it does raise concerns as to how do we get to this promotion. This belief was also reiterated in the federal consent decree that was just recently dismissed, which included a provision that prohibited officers with questionable conduct from also attaining leadership positions. And I think with the guise of understanding that having officers that do ascend within MPD that have shot and killed black and brown residents does send a very troubling message to our residents that you can do that and not face any repercussions whatsoever, and also hurts trust that we're trying to build. So I know I can speak for myself, but I know many of my colleagues were remaining committed to figuring out how to hold accountability in this matter. We took up a lengthy conversation, debate last council cycle on how we could pursue incorporating the federal consent decree terms in the MDHR settlement agreement because of things like this, because we need legally binding police reform, because promises are always broken around here. So I just wanted to reiterate, I know me and many of my colleagues stand in support of our residents in finding out a pathway forward from this, and that it is completely unacceptable, and it continues to double down on harm and trauma that many of our residents have been experiencing and had to endure from the condition of policing in our city. So I just wanted to name that because we got lots of outreach and media inquiries regarding this.
Thanks for sharing that, Vice Chair Wansley. All right, colleagues, seeing no further business before us and seeing no one on queue, I will declare this meeting adjourned.